Today we're going to be talking about reaching. Primarily reaching behind your back or into your back pocket. This video was inspired by a comment that came up of someone wanting to know how to do this. But there's other things that this is good for. We need to be able to reach behind us to push up from a wheelchair, pull our pants on, washing our back. So those are some other things that would fall into this category of being able to reach into your back pocket. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to neurologic conditions, with the end goal of empowering you with as many tools as possible to take a little control of your rehab program and ultimately reach your rehab goals. And all that being said, today we are going over reaching. So I'm going to break this down into a few different segments. First and foremost, this is as it relates to someone who cannot perform this movement after damage to your brain or your spinal cord. So the first little bit of this video, I'm going to go into some secondary injuries that can happen after damage to your brain or your spinal cord that might be more orthopedic related, as well as some of the main problems that occur that we talk about in a lot of my videos that are related to this movement or this inability to reach behind your back, break the movement down, what's going on at each joint, and then of course giving you some solutions or some exercises that you can do to address these issues. So first and foremost, what are some secondary injuries that can happen after a stroke or a brain injury that can cause this to happen? Two main ones that come to mind are a subluxation, and that's when the shoulder is not approximated in the joint, and frozen shoulder. Frozen shoulder is when the capsule around the joint actually shrinks a little bit or tightens up. And in this context, there's a lot of things that can cause frozen shoulder, but in this context, it's most likely due to not moving the arm for a prolonged period of time, as well as spasticity. You guys know I love to talk about that, abnormal synergy patterns, and weakness. So those are all the things that can cause this. Now, as far as the spasticity, usually the muscle that is overactive or you're getting that involuntary contraction that will inhibit reaching behind you is the bicep. This will probably make sense to you, but the bicep flexes the elbow, so that might be what you see. But what you might not know, or what's a little less obvious, is that the bicep also brings the arm forward. So if you have involuntary contractions in that arm, you try and go and move and the arm comes forward, you can't bring the arm backwards, or you have that extra resistance inhibiting you from the ability to move that arm backwards. So that is the muscle or the culprit for as far as if you have any spasticity in your upper extremity that would limit your ability to regain the movement of reaching behind you. Abnormal synergy patterns, most common is a flexor synergy pattern. That's when the arm internally rotates, adducts. That's the really important one. When I get to breaking down what's going on at each joint to reach behind you, this will make more sense. But an abnormal flexor synergy pattern is adduction, internal rotation, and elbow flexion. So again, that bicep's going to be involved, which is going to make it harder to reach behind you. Also, just straight up tightness from not moving. So the pec major, pec minor brings that shoulder forward, making it harder to reach back. And of course, everything else that we said also brings that arm forward, making it harder to reach behind you. Now, what do you need to be able to do at the shoulder in order to reach behind you? Well, you need internal rotation. So imagine that arm behind your back. You need to be able to internally rotate at the shoulder and abduct at the same time. That goes back to that abnormal flexor synergy. You're internally rotated, but when you internally rotate, that arm is going to glue to your side. You're not going to be able to get that arm behind you, and the bicep is going to bring it forward. So you're internally rotating, abducting the arm, and extending the arm behind you. Again, not very comfortable for someone who has spasticity in the bicep, as well as, to a lesser degree, and again, I'm looking at this from a neurologic perspective. There are probably orthopedic physical therapists out there that might disagree with this a little bit, but you do need to be able to retract your shoulder blade. So the shoulder blade or the bone in the back needs to be able to go backwards. In most cases, after damage to your brain or your spinal cord, that shoulder blade is sitting so far forward that there is no way structurally that you're going to be able to get that hand back there because of that, because that shoulder blade is sitting so far forward. So what are we going to do about it? Now, this is not an extensive list. I'm really just highlighting a few of these areas, but the reason I go into that explanation is when you guys are scrolling through social media or Instagram or following other therapists, which I follow a lot of therapists too, and they have a lot of great ideas, especially a lot of orthopedic therapists and sports physical therapists, of stretches and things that you can do to improve these movements. At least now you can look at it from a neurologic lens and say, okay, I should be doing that or I should not be doing that. And you can kind of help to decide what exercises are best for you. But all that being said, what we want to do is you want to be able to regain the ability to retract that shoulder blade or bring that shoulder backwards. So stretching all the structures on the front of the shoulder that bring it forward, really, really important. So the key for this exercise is somehow get your hand to stay on the surface that you're sitting on. I know for some of you that will be a challenge. If you can get someone to hold your hand there, that would be best case scenario. And then all you're going to do is just very carefully and slowly just lower yourself down to what I have here is just a step stool. And because this is a stretch, you want to hold it for at least 30 to 60 seconds. Longer if you can tolerate it. You should feel a good stretch all across the front of your chest. In that same category, scapular retraction or relearning how to squeeze those shoulder blades together. So this is scapular retraction. What we're trying to do here is just open that chest up by squeezing those shoulder blades together. Those are the big flat bones in the back. When you squeeze, you really want to think about kind of if you had a finger in between your two shoulder blades, you're trying to pinch your finger in between those two shoulder blades. So you're just going to squeeze back. You should really feel your chest open up. We'll go ahead and look at this from the back. So you're just squeezing those shoulder blades together. Again, like you have something in between your shoulder blades and you're trying to pinch it. As well as anything learning how to extend the thoracic spine. I forgot to mention that earlier, but anything where you have to learn how to extend, that's also going to get the shoulder in a better position to be able to reach behind you. So this is a thoracic extension stretch. I like having a roll like this. This is a 1/2 foam roller, or have something kind of somewhat firm. You can roll up some towels and put it back there, and somehow you want to get it right about at your waist level, maybe even a little bit higher. And then you're just going to arch your back over the top of the roll. You should feel a really good stretch through the front of your body, especially if you're really tight and you're really forward with your shoulders. You want to hold it about 30 to 60 seconds. So that's related to the shoulder blade. You need to be able to learn isolate some key movements at the shoulder joint. We call this the glenohumeral joint because the shoulder is actually made up of several joints, but at the glenohumeral joint, you need to be able to internally rotate. So just working on isolated internal rotation with abduction. So with the arm out to the side, really, really important. You may be able to do it here, but being able to do it here out to the side it might be a little bit tighter. There might be some structures that interfere with that. So you're going to use the rod to help you reach that arm behind your back. The goal is to internally rotate that shoulder. That's mainly what we're trying to work here with a little bit of shoulder extension. Very challenging for a lot of people to do this motion. That is why you really want to use that bar, and you really do want to have your hands strapped to the bar. And you're using your uninvolved hand to just pull that hand across your back. Here's what it looks like from the back. You're just pulling that arm across. Pulling that arm across, using your uninvolved arm to pull that arm across. Along those same lines, just straight up abduction. For a lot of you, you may think you're abducting, but you're really probably just leaning. So isolating again, just that deltoid on the outside, abducting that arm. So you're using your uninvolved hand to help move that arm in that direction. I'll show it to you sitting, but I always recommend doing this one starting laying down. It really helps you to just isolate the shoulder and not compensate by tipping your body, which is very, very common. A lot of people do that. So nice and easy, out to the side, just like that. Again, helping as much as you need to with the uninvolved hand, but not more than you have to. As far as the extension, now the main culprit here is actually more tightness or spasticity than it is weakness on the muscles that extend the arm. Now those are involved, and yes, those are weak, but really the culprit's all the resistance from the bicep. So really good bicep stretches, stretching that bicep out, elongating those muscles on the front of the arm. You want kind of a heavy chair. You can see I have a weight on the chair here to make the chair a little bit heavier, but the heavier the chair, the better, and the wider the backrest is on the chair, the better. So you just want to hook your hands behind the chair, and then you're just going to step forward, bring your hips away from the chair just to open that chest up, really stretching all the muscles on the front of the arm, or the muscles that flex the arm and bring the arm forward, as well as the chest. Then you just want to hold it 30 to 60 seconds. And then of course you do also want to learn how to actively extend the arm. So that's really important, or reach that arm behind you. This is one variation of a bent over row. What we're trying to do is strengthen the muscles around the shoulder blade. So you're going to bend over and bring that arm back. What you really want to focus on is that you're trying to squeeze your shoulder blades together. Really, really important muscle to regain the strength in order to get arm function. So although it looks like the arm is moving, you're really trying to focus on that shoulder blade, the flat bone on the back side of the shoulder. So you're going to bend over and you're really going to squeeze that shoulder blade back as you bring that arm up. And again, you're really focused on the shoulder blades and squeezing those shoulder blades together in the back. Also did mention the subluxation, so anything weight bearing on that arm to keep that arm approximated. Also protecting that shoulder. I've done a whole video on subluxation, but if you are sublux, the best thing you can invest in is something to support that arm. If you're in a wheelchair, I love a wheelchair tray table. Definitely super important to support that arm and keep it approximated, but also anything weight bearing. I've got a variety of weight bearing activities on this channel. Definitely want to do weight bearing through that arm. And then just generally speaking, I really do believe that spasticity in the bicep is one of the main culprits. So anything you can do to work on shoulder movement in any direction, I suggest anytime you're working on your shoulder motion, try and do a portion of your shoulder exercises with your arm in an immobilizer. I will put a link for one in the description below. What you need to do is break up those synergy patterns. I've done whole videos on abnormal synergies, but you really do need to learn how to uncouple those joints from always working together. So that is it for this video. I hope that answers your question, the person that asked this question or wants to learn how to reach behind you. Remember, also critical for washing your back, pulling your pants up in the back, pushing up from a wheelchair. So a whole variety of reasons as to why this is a good movement to practice or regain. As usual, if you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so that you'll get notified every time I upload new videos. I enjoyed spending time with you all today, and I look forward to seeing you in the next video. Have a good day.